Hello, everyone, and welcome to the webinar on matching funds and strategic initiatives. So you can listen to this webinar in English, French, Spanish, and Portuguese. Please click on the interpretation button at the bottom of the screen to select your preferred language. Presentation and recordings in all 4 languages will be shared with all registered participants by email after the webinar. The recording from previous webinars are already available on our Island platform. So today's session will provide an overview of matching funds and strategic initiatives in the 2023-2025 allocation period, before taking a closer look at matching funds for HIV prevention, tuberculosis, and resilient and sustainable systems for health and cross-cutting topics. We will then have time for a Q&A session. So we invite all attendees to enter any question they have in the chat during the presentation. We'll collect these questions and project them during the Q&A. And with that, I will now hand over to Emily Hughes from the Strategic Investment and Impact Division, who will start this webinar with an overview of matching funds and strategic initiatives in the 2023-2025 allocation period. Thank you, and over to you, Emily.
Thank you so much. And I will provide a brief overview and then hand to my colleagues to go through each of the matching funds and complementary strategic initiatives. Next slide. So when we talk about catalytic investments, there are 3 modalities that we use to deliver these, in addition to, in complement to our grants, and as well as the domestic resources to incentivize increased resources, innovation, and prioritization, again, leveraging those grant or core investments. These 3 modalities are matching funds, strategic initiatives, and multi-country approaches. We'll be focusing today on matching funds, and these are the funds available to selected countries to incentivize the programming of the country allocation toward key strategic priorities, as well as strategic initiatives, which are centrally managed approaches for areas that cannot be addressed through country allocations alone. Multi-country approaches are on a differentiated timeline. Next slide. As a brief overview on the current cycle as we move into grant cycle 7, we did want to give a perspective of the investments in this cycle with the gray bars versus the green. We do have a more focused investment portfolio here, including investments, complementary investments from the private sector. So you'll see here that matching funds has the greatest emphasis this cycle. Next slide. This slide is an overview of each of the priorities that were approved by the board and the different modalities that that priority will use to implement accordingly. Also, you can see here that this cycle has components associated with each priority to maximize impact. You'll see on the far right columns the amounts of funding per component across these different investments. Next slide. In terms of the matching funds, we have 5 of the catalytic investment priorities associated with these. And you can see here each of the components, as well as the number of countries in which these components will operate. These were further outlined in allocation letters. Next slide. In addition, this cycle, we also included strategic initiatives in allocation letters where there was a country-facing component. You can see here that there are 2 SIs that are available globally, as well as ones that have a more regional or global approach. In addition, we have the emergency fund, which does not have a predetermined country focus. Next slide. On next steps, in addition to this learning opportunity, we will be working with different levels of governance in terms of both the matching fund and strategic initiatives to go through more of the operationalization. These are further updated to our Global Fund governance structures, such as the Strategy Committee and the board. Each of the following sections will go through matching fund by matching fund, as well as with the country-facing strategic initiatives. Next slide. Without further ado, let me hand over to Siobhan Crowley on HIV prevention.
Good morning, good evening, good afternoon, wherever you may find yourself. My name's Siobhan Crowley. I'm the head of HIV here at the Global Fund. I'm going to talk to you briefly about the HIV prevention matching funds. So if I could have the next slide, please. As you may have seen, you probably haven't had a chance from Emily's rush through those other slides, but there is a total of 49 million of matching funds available for HIV prevention. And the focus of all of our catalytic investments this cycle is on accelerating results in terms of HIV prevention, because prevention is still lagging behind in terms of treatment progress. So what are the main objectives of the matching funds that are there for countries? Essentially, we want to improve HIV prevention outcomes. And obviously, these are most needed for those populations who are at greatest risk of acquiring HIV. That is key populations. In some countries and some settings, adolescent girls and young women and their sexual partners. Importantly, we have a bunch of new ARV-based, antiretroviral-based prevention options available. And we really want to see many of these countries lift and accelerate the use of these products among those who most at risk and need them to be used. There are still many, many policy and regulatory barriers, so the matching funds are meant to be used to try and shift some of those. We also are encouraging countries to adopt a prevention systems approach. You'll all be aware of health systems thinking, but people need to start thinking of prevention systems. COVID has very much illustrated that. The matching funds are also there to make sure that services become more people-centered, i.e. based around, where people access services, how they want to access services. And that includes, of course, community-based and community-led services. Alongside a couple of the other RSSH and cross-cutting matching funds, these funds are also there to catalyze PrEP access and uptake, and also stimulate the market. And you will hear from colleagues later around the market shaping, the digital, and the human rights matching funds, which are obviously going to improve HIV outcomes. The interventions that are necessary to shift those prevention outcomes, and those prevention outcomes are spelt out in the theory of change and results framework, which is detailed in the HIV information note. And there is guidance also on the web around what we mean by HIV prevention outcomes. So really, these funds are asking to improve and shift gear on those prevention outcomes. Next slide, please. The countries that are eligible are obviously those where we are most concerned about HIV prevention not matching the status of the epidemic. So high HIV incidence, high sexually transmitted infection rates, particularly for some of the countries where we're worried about young girls, it's gender-based violence and interpersonal violence. And so the range of countries that you will see reflects that. Just to point out that in some of the countries, the actual burden of HIV may not be so great, but the status of KP services or those communities' access to services particularly of concern to us. So that is why those countries are included. So we end up with 3 different categories of matching funds being suggested. One set of countries are really to focus on shifting PrEP, because we've seen people's uptake of PrEP, countries' uptakes and programs' uptakes of PrEP incredibly slow. And we now have so many options, we need to see a change in that. In some countries, while we're seeing big progress in terms of reducing incidence of adolescent girls and young women, some countries, there's a couple of other countries that are worrying us, but some of the countries we want to just double down and make sure that those trajectories of improvement are maintained. And 12 countries are eligible for the key population matching funds. Let me move to the next slide, please. So the countries that are eligible and the amounts of matching funds that are available for the countries are on this slide. So we have the 12 countries who are eligible to request for key population matching funds. You see them on the slide there. I don't need to go. And the ranges are all between 1 and 2 million. We have 5 countries that are eligible to request 8 adolescent girls and young women matching funds. A couple of these countries are smaller countries where the grant allocation in this cycle, because actually they're doing well and incidence is declining, their actual allocation has decreased. So those are why those countries are particularly being offered matching funds. A couple of other countries, Mozambique, for example, is offered both adolescent girls and matching funds, but also quite specifically some additional matching funds for PrEP. And then the countries on the third panel there are offered performance-based matching funds for PrEP acceleration specifically. And they have specific targets attached, which if the targets are met by the midpoint of June 25, they are released a second tranche of matching funds. That's why you see the 2 columns, and the total is also indicated for you there. Next, please. So in totality, what the HIV prevention resources look like is 49 million, of which, as I said, some 10 million is performance-based. There is no country receiving less than 1 million, and there's no country receiving more than 6.5 million. And we've tried to layer this so that the matching funds can be deployed in a way that's reinforcing and interdependent. And you will also hear from other colleagues around some of, as I said, the cross-cutting and the human rights related matching funds, which are also fundamentally really important for changing HIV outcomes. Next, please. So in order to access matching funds, certain access conditions need to be met. So that the 2 important ones to understand is firstly, that if we, for example, say 1 million of matching funds, then the country has to make sure that at least 1.5 million is available as a match for HIV prevention activities. And it's obviously that if you use the modular framework, which is how you sort of allocate and understand where the resources go, that's where you would see. So we need to see 1.5 match for those matching funds. And what we also need to see is that they maintain or increase the level of investment in HIV prevention from the last allocation cycle. So what we don't want to do is put matching funds in and see that the actual country allocations decline. Then specific programmatic conditions is that there obviously must have been some estimation of the population that you are seeking to target. There must be some evidence that you're making progress on what we call the HIV Prevention Program Essentials. You may or may not be familiar, but this cycle, grant cycle 7, we have program essentials spelled out, things that we expect to see in every single HIV program. And we need to have some confirmation that there's going to be an expansion of the service delivery platforms for prevention and or scale of HIV prevention. There needs to be a plan and budget for data systems, because many countries are struggling to look at, collect and understand their prevention data. There needs to be some signal of which innovation or scale option is being pursued through the matching fund. And we need to see evidence that the key stakeholders, the multi-sectoral stakeholders that are necessary in prevention program planning have been involved in the decision-making, allocation of resources, choosing exactly where, who, what, and why. Next, please. For the matching funds for specifically designated to the PrEP targets, the countries that I indicated in the box with the different countries, there is, in order to release the performance-based characteristics, there are a couple of more programmatic conditions that will be applied. Firstly, they need to use geographical and population risk data to make sure that targeting of PrEP for those who are really very high risk of acquisition is in place. The plan and budget must include more than 1 PrEP option, remembering that we will now have 3 PrEP options, a long-acting injectable, an oral PrEP, and a vaginal ring. and they are all in their allocation letters have a specific target, which is what releases and unlocks the third phase of payment. And I think that I will now be handing over to Jamie Tonsing for the TB matching funds description. Thank you.
Thank you, Siobhan, and I will be walking through the next 4 or 5 slides about TB Matching Fund. I'm Jamie Tonsing. I'm the Senior Disease Advisor for TB at the Global Fund. Next, please. So for the TB Matching Fund, the priority area is to find and treat the missing people with TB, both drug-susceptible TB or DSTB and drug-resistant TB or DRTB. And the objective for this area is mainly to find and successfully treat the missing people in order to improve TB treatment coverage and treatment success rate. So that is the objective to why we're prioritizing this area to improve health outcomes. And the key interventions we want to incentivize by making matching fund available for this is number one, to make sure that the matching funds catalyze early and accurate diagnosis of TB. And we want this, we can do this through a range of innovative approaches that are now available with new tools, for example, for digital X-ray or computer-aided detection AI software, using better rapid molecular diagnostics and improved bacteriological confirmation of TB. Secondly, we also want that people with TB symptoms who come to health facilities are systematically screened for TB. And outside of health facilities, that we target high-risk groups through active case finding, really reaching community-based, outreach-based care to reach the people with high risk for TB and screen them and put them on treatment. In addition to these two, you know that in some countries, there's a huge private sector where people go and seek care. There are also countries and contexts where community-based services are very important, or there may be other specific focus areas which are contextual. And so we need to, depending on what the context for that country is, bring about all these interventions into play to all with the interest to find and treat the missing people with TB. And doing all this, I think we have to make sure that the approach is designed in a way that is decentralized, that is ambulatory, that is patient-centered care, so including through primary health care and community support. Next, please. For choosing the context, choosing the countries or prioritizing countries, we considered 3 epidemiological criteria. One was the countries with high TB incidence, countries with high TB mortality, and countries where we saw a huge gap in TB treatment coverage. So this is the gap between the estimated number of TB in a certain country and the number that they notify to a national TB program, so that TB treatment coverage, the wider the gap is, the more the country got prioritized. And through this exercise, we came up with a list of 20 countries that are listed there. And all of them are in either high TB burden countries in Asia or in Africa. I think in addition to that, you will also see Cameroon and Ukraine, which are outside of this region, but most of them are in these 2 set of regions. And through this exercise, these countries actually contribute to 75% of the global TB burden of DSTB and 66% of the global burden of DRTB. And when you count all 20 countries together, they account for 78% of the people missing with TB globally. Next, please. So yeah, like what you heard in the HIV slides, we also have access conditions and programmatic conditions to be able to access this matching fund for TB. Firstly, on the access conditions on my left side, it is a 1-to-1 match. So every, as Siobhan explained, so if the country is getting 1 million, they have to get also allocate at least 1 million from their allocation, 1 million or more. It has to be at least 1-to-1. Yeah. And in addition, we specified 3 areas of focus per country. You will see them by country in the next slide, but for each country, we specified either A or B or C as an approach that they need to spend their money on, for the matching fund money on, that I'll cover in the other slides to make it clearer. On the programmatic conditions, there were 3 of them. One was that the way programs have to be designed in such a way that it has to be a scale up, not incremental, but really shifting gears, accelerating, scale up innovative approaches to accelerate progress to find and treat the missing people with TB, based on the country context and the lessons learned. Secondly, interventions have to align with the priority interventions on TB screening and on TB diagnosis, which are further elaborated much more in detail in the Global Fund's TB information note. And then thirdly, we want that there should be a good mechanism to monitor and report on progress in this area. So countries that are receiving matching fund, for example, should select indicators that are related to screening, diagnosis, treatment success rate, and be able to report outcomes against all of this through the existing grant performance reporting, through the PUDR, for those of you who are familiar with it, through the performance framework initially in the application submission, and then through the PUDR. Next, please. So this is the slide that I spoke about. You have the country listed on the left side in the column, and you have the amount per country, and you will see that all countries are getting 4 million per country, except 2. Bangladesh will get 5 million, Nigeria will get 5 million, and these countries were incentivized because they did a great job in the current allocation cycle in using the matching fund to really move things. And the third column is really what are the specific focus area we want countries to focus on. So for example, with Cameroon and Ukraine, we want them to, we have specified on what we want them to focus on, which is around early and accurate diagnosis, really targeting high-risk group populations, ambulatory patient-centered care, and including through primary healthcare approach and community-based service. So very much similar to the things that were in the key intervention earlier. And then the set of countries that are in white here, mostly these are all in high impact Asia countries, because they have a huge private sector. So we're specifying that these countries need to spend their money on really deepening and accelerating implementation of private sector engagement through innovative models. And then for the rest of the country, we're saying, let's have a good dialogue on what are the best approaches considering your country context to find and treat people with DS and DRTB. So I think that's my last slide. Thank you very much. And I will pass on to my colleagues to present Olga, I think, Olga and Rob to speak about RSSH Innovation Fund. Thank you.
Okay, hi everyone. My name is Olga Bornemisa, and I'm one of the Senior Health Systems Advisors at the Global Fund. So I'm just going to give you an overview of the RSSH Matching Fund, and then talk about the RSSH Innovation Matching Fund in more detail, and then I'll hand over to other colleagues. So next slide, please. So essentially there are 4 RSSH matching funds. 3 of them are grouped together under incentivizing RSSH quality and scale, which is the priority area that Emily showed you at the beginning. And the 3 are the RSSH Innovation Fund, which I'll talk more about, which covers 10 countries for $50 million. So it's the biggest one. There's Digital Health Impact Accelerator Matching Fund, which covers 5 countries for $10 million. And there's the Integrated Lab System Strengthening Matching Fund, which covers 5 countries and for a total of $10 million. The 4th RSSH matching fund is one called Effective Community Systems and Responses, so CSNR, and it covers 8 countries for a total of $42.5 million. Next slide. Okay, so I'll go through the RSSH Innovation Fund matching fund in more detail. So next slide. Okay, so the main objective of this $50 million RSSH Innovation Fund is quite broad. It's to support increased quality and scale of integrated people-centered health services and health systems in order to strengthen HIV, TB, and malaria and other health outcomes, as well as contribute to pandemic preparedness. Now, within this, there are 3 main interventions plus a 4th at the bottom. So the 3 main interventions are human resources for health, including community health workers, as well as improving quality of care, which is incredibly important. The second area is about enhancing national laboratory systems, and the third area is about strengthening in-country supply chains. Fourth area is that the matching fund can be used for targeted health facility assessments. And some countries have already been noted in their allocation letter that we would like them to work on these, but we would encourage all of the countries that get matching funds from the RSSH Innovation Fund to fund targeted health facility assessments, to make sure that they have the data to be able to measure how well they're doing around the integrated, people-centered, and quality of care. Next slide. So if you look on the left, and sorry, these slides are slightly cut off on the bottom. So on the left, you can see how the RSSH Innovation Matching Fund fits in with the other matching funds. So along the side there, you can see all the different countries that have been allocated some matching funds. And along the top in the green, you can see the 5 different areas that have been allocated money. So the first one is HRH and quality of care, including community health workers. And you can see that all of those numbers down the side are in green. So that means that they're funded by the RSSH Innovation Matching Fund. The next area is community health workers, CBOs, and CLOs, community-based and community-led organizations. And that's in blue. So that area will be mostly funded by the CSNR Matching Fund. However, you'll note that community health workers are included in both, and that the countries are different. So we've done that so that if a country in the green under the HRH quality of care who's receiving matching funds from RSSH Innovation Fund wants to work on community health workers, they can. And so that the countries are complementary and we're able to scale up the number of countries working on community health workers. For labs, you can see it's a mix of green numbers, which are the RSSH Innovation Fund, and ones that are in white. And so we've managed to double the number of countries being funded for lab systems. So half of them are being funded through the RSSH Innovation Fund, and the other half under labs are being funded by the lab matching fund directly, but they'll be sort of managed as a group. Supply chain is another area. As I said, it's a third area there for the RSSH Innovation Fund. And you can see they're all in green, so they're all being funded by the RSSH Innovation Fund. And then the digital health is being funded by the Digital Health Matching Fund. So overall, just to show you, this is the big picture, and it shows you how the RSSH Innovation Fund maps onto all the other RSSH matching funds. Next slide. So as I said, there was 3 main areas: the health workforce, quality of care on the left. This is mostly funded, focused on HRH, including the community health workers, and focused on really the strategic planning, as well as the optimization of the health workforce, trying to do the analytic work as well as implementation to make sure that the right healthcare workers are in the right places and are being paid in a timely manner. The second area under this is the quality of care to enhance performance. And under this, you can have a whole wide variety of quality of care interventions, including supportive supervision, more integrated training that uses problem-solving techniques, continuous professional development, competency-focused pre-service education for integrated care, as well as organization of services to allow for better referral and counter-referral. Under national laboratory systems, there's 3 main areas, and these are the same areas that Patrick will talk about under the laboratory matching fund. So it's about scaling of network coverage and rapid responses, systems intelligence, data science, and systems monitoring, and improvement of laboratory infrastructure. And then on the right, for the 3 countries that are getting in-country supply chain, this focuses on 5 main areas which countries can select from: storage and distribution and design and operations of supply chains, information systems and data use, strategy and governance to be able to develop these supply chains and improve them, waste management, which is incredibly important, especially given all the C-19 funding and all the PPE and others, the test results that need to be disposed of properly, and then the outsourcing of logistics services. Next slide, please. So these are the countries that have been selected for the RSSH Innovation Fund. They were selected because we found that they had a potential for impact and scale up of services. They're generally higher burden, lower income countries and lower middle income countries that have a relatively lower maturity of integrated health systems and integrated services. We, upon discussion with various country teams, thought that they had an enabling environment and that the governance was good enough to be able to put in a good matching funding request, and also that there was country demand and absorption capacity. And we also, as similar to the other matching funds, tried to make sure that the size of the matching fund was linked to the size of the allocations, and so that they would be able to match. So next slide. So the access conditions, it's basically a one-to-one match from the matching funding to the grant, and they both have to be funding the same area that's being supported. In terms of programmatic conditions, we tried to keep it fairly simple. There's three main ones. The first is that we would like to have plans to pilot or to scale up evidence-based high-impact interventions that are based on country context, epidemiological profile, and lessons learned. We would like to ensure that the funding requests are really aligned with the RSSH critical approaches, which are outlined in the RSSH Global Fund's RSSH information note. And finally, that the RSSH gaps and priorities annex is fully filled in and aligned with national strategies and plans. So if we go to the next slide, these are the countries again. You can see which areas again have been selected and the total amount of matching funds for each country, and then the percent of the matching fund for each of the countries. Next slide. And so now I'm going to hand it over to Rob Cryer, who's going to talk about the Digital Health Innovation Accelerator Matching Fund. Thank you.
Thanks, Olga. So if we could go to the next slide, please. This is the Digital Health Impact Accelerator, which is an evolution from the Data Science Catalytic Fund from the previous cycle. But the Digital Health Impact Accelerator really wants to focus on what we were referring to as the last mile capacity. So this is really trying to target the primary healthcare facilities and community health workers and improve their connectivity and the interoperability and integration of the systems used in that context. So we're looking particularly under the last mile capacities around connectivity and power, but we're also looking at the integration between the systems that are used in that context, both vertically to roll up to the HMIS system, but also horizontally. So we're looking at the connectivity, for example, between the lab systems, the supply chain, and an electronic health record solution to try to give the clinician as much information as they can to improve patient care. And also as part of that, we'll be trying to improve the country's ability to digitize this data at source and therefore speed up and support the ability to do disease tracking because of the infrastructure is in place. Next slide, please. As Olga mentioned earlier in the overview, this matching fund is targeted at 5 countries. That's Burkina Faso, Ethiopia, and Rwanda, as a continuation of the work that had already been taking place as part of the Data Science Catalytic Fund, so to continue that work. But we've also included South Africa and Zimbabwe in this fund. The basis for this is that the fund is supported primarily by the private sector, and one of the biggest donors in this case is Anglo American, who have a lot of activity in in South Africa and Zimbabwe, and so we're supporting the work that they're already doing in that regard. So these would be the 5 countries, and the split. Next slide, please. Thank you. The split of the 10 million is equally spread across all 5 countries. You can see there it's 2 million per country, primarily to facilitate that that interoperability and connectivity, as mentioned before. And next slide. So the access conditions for this. Sorry.
So the Spanish channel has switched into English. Could I kindly request that the Spanish interpreter move back into the Spanish channel?
Thank you. So the access condition here is primarily a one-to-one match. So the 2 million from the matching fund is matched by 2 million from the main grant, and also must align to the objectives outlined previously in the earlier slides about last mile and interoperability. The other thing that is also clear, as you'll see across the RSSH funds, is that they're not operating in isolation. And so one of the programmatic conditions that we want to be able to see is how the investment in the last mile and the interoperability also works with the other RSSH interventions in, for example, in community health or labs and supply chain. So there must be synergies and some joined up thinking in the way in which the investment in the last mile matches those other investments that we would see. The other condition that we would be looking for is that we don't want to see point solutions, but really this should be something that has the ability to scale up to, nationally. So the solutions or the approach has that the capability to be done at a national level, and also some thought about the business model that would be put in place. This isn't there's a bigger need here than just buying the hardware and having a project to do the installation. It will need maintenance over the duration of its lifetime, and therefore support for the solution as that goes forward. And so some thinking around what would it be, how would this be sustainable, and also linked to this whole piece about linking with the community health and with labs and operability, interoperability. It should also be part of the agreed national digital health strategy. So again, making sure that everything is pulling in the same direction and is a coordinated solution. So the digital health strategy, and also please refer to the RSSH information notes for more detail on how the architecture should all be put together. Thank you. And at this point, I would like to hand over to Patrick to talk about lab system strengthening. Thank you.
Thanks very much, Rob. My name is Patrick Royal. I'm the project manager for the current Lab Strategic Initiative at the Global Fund. Our matching in fund investments in Grant Cycle 7 build upon a number of key successes gained in Grant Cycle 6 through national investments in improving integrated laboratory systems. On the next slide, you'll see that these investments facilitate opportunities to rapidly scale integrated laboratory service delivery with the support of matching funds to respond to HIV, TB, and malaria, as well as COVID and other priority diseases. A key lesson that we've learned over the past 3 years has been that empowering lab directorates creates an enabling environment for horizontal system strengthening to serve disease response, and it provides a fertile ground to adopt and scale up integrated service delivery. Our objective in Grant Cycle 7 through matching funds is to strengthen laboratory systems readiness levels for improved HIV, TB, and malaria service delivery, and to advance capabilities to detect and respond to health threats of pandemic potential, accelerating uptake of innovations and improving access to integrated diagnostics. The key interventions that we've prioritized are based upon the recognition that we urgently need to maintain momentum in reorienting advances made in service delivery during the COVID-19 response and create an enabling environment for integrated approaches to be successful. Adoption of innovative approaches and best practices are vital to ensure success of horizontal system-level investments. The activities and scope for support for the countries that have been defined are scaling network coverage and rapid response, systems intelligence, data science, and system monitoring, and improvement of laboratory infrastructure and supportive services. Activities that fall within these categories are diverse, but they must be tailored to the national realities of country applicant. Activities should be adapted to existing laboratory systems and consider the critical dependencies between infrastructure, systems, and resources to ensure that the enhancement of integrated laboratory service delivery is embedded. Finally, defining these activities through the country coordinating mechanism necessitates that the lab directorate be actively present and participating in defining the scope of work, along with a broad set of stakeholders from various laboratory institutions within the country. A few other examples of eligible activities are shown on screen. However, the applicants should also use the RSSH information note and the modular framework to define activities relevant for support. On the next slide, you'll see the countries that are proposed, that have been defined to benefit from this scope of support: Ethiopia, Ghana, Laos, Nepal, and Uganda, with additional countries funded through the RSSH Matching Fund being South Sudan, Zimbabwe, Liberia, and Sierra Leone. Eligibility for support was determined by countries demonstrating demand for technical support to take up complex interventions and adopt best practices in lab system strengthening, identified through the interactions with lab directorates, the ministries of health, partners, and our TA providers who are currently deployed in the countries on ongoing initiatives, and countries that have been supported through previous investment that are in need of continued and sustained support. We've given attention to the countries in which the external evaluation scores, such as SPAR, Joint External Evaluation, or LabNet, in isolation fell behind the average national score for laboratory system strengthening, indicating suboptimal support to the lab system in comparison to other capacities. To encourage the longevity of our investments in matching funds, we focus on countries with engaged leadership of the lab directorate and a technical working group to ensure the sustained support throughout the 3-year implementation period. And it also allows us to focus on adoption of best practices and innovations beyond Grant Cycle 7. On the next slide, in our access to funds, are the conditions of the receipt of the funds. The country must invest a portion of their total country allocation, that is through their HIV, TB, malaria grants, that is greater than or equal to the amount of the available matching fund in lab system strengthening activities that are detailed in the RSSH information notes or the modular framework. Conditions for access are a one-to-one match is expected from the grant funds, totaling $2 million invested by the country through their grant, matched with $2 million for a total of $4 million invested in the selected interventions and activities. The activities must be directly related to or contributing to advanced uptake of integrated service delivery, whereas siloed or disease-specific interventions are not eligible for consideration. That is, specimen referral networks specifically for tuberculosis would not be considered. However, integrated solutions would be between tuberculosis, HIV, and other priority diseases. Activities must be aligned with the integrated lab systems principles in the RSSH information note. and adequate resources must be allocated to capacity building and human resources development to sustain the outputs of activities. On the last slide, you'll see the distribution of countries with a proportion of funds that are available per country. And I'll now hand over to Nick Oliphant to speak about community systems and response.
Great, thanks, Patrick. So part 7 here, we're going to talk about effective community systems and responses, or CSNR, contributing to improved health outcomes, equitable access to integrated people-centered quality service. It's the matching fund. Next slide, please. So the main objectives for this matching fund are to catalyze investment in systems readiness for scale, institutionalization, and sustainability of the CHW workforce, community systems strengthening, particularly for community-led organizations and networks of key and vulnerable communities, and lastly, embedding community-led monitoring and use of community-led monitoring data for decision-making. The key interventions are strengthening CHW programming to catalyze systems readiness for scale, institutionalization, and sustainability of the CHW workforce, and accelerate CSNR, or community systems and responses, for key and vulnerable population-led organizations. Incentivize investments to build operations, technical, and governance capacities of community-led organizations or community-based organizations employing community health workers, for example, peers, to reinforce linkage and mobilization of community health workforces, community-led responses, and gender transformative community systems. Note that this priority area includes private sector funding that is fully aligned in terms of aims, interventions, conditions for accessing matching funds and eligible countries. Next slide, please. So the countries eligible for this matching fund are indicated on the left. There are 8, including Burkina Faso, Cote d'Ivoire, Ethiopia, Kenya, Liberia, Mali, Senegal, and Zambia. And the principles and rationale for country selection are on the right, notably the country context for community health, the potential for catalyzing community health system functionality and readiness for scale, the potential for impact, global fund prioritization, including consultations with our grant management division and other internal stakeholders, the size of our existing global fund investments, absorption capacity, complementarity with anticipated grant investments, including the RSSH matching fund, COVID-19 response mechanism funding, including our essentially managed limited investments such as Project Birch, geographical and language diversity, and country interest or demand. Next slide, please. The access conditions are as follows. Countries must invest a portion of their total country allocation that is greater than or equal to the amount of available matching funds, that is at least a 1-to-1 match, in the eligible interventions for community health workers, programming, and community systems strengthening, described in the CSNR investment focus, which will be included in Global Fund's matching fund guidelines that will be disseminated shortly and available on the Global Fund website. The term CHW here includes all types of CHWs, including peers and other types of CHWs employed by the public sector or civil society organizations, including community-based organizations or community-led organizations. The programmatic conditions, which also must be met and will be evaluated by the TRP during its review, include a demonstrated meaningful engagement of the Ministry of Health, community health units, CHWs or CHW associations, community-led organizations, and community-based organizations employing CHWs in funding request development and grant making. Investment must be aligned with the guidance on CHWs and CSS outlined in the Global Fund's RSSH information note, as well as the eligible interventions outlined in the investment focus. Again, that will be included as part of Global Fund's matching fund guidelines and available on the Global Fund website. There must be submission of a completed CHW programmatic gap table aligned with national strategies and plans, a community health strategy or plan to develop one that integrates CHW's community-led and community-based service delivery, included a costed operational plan, and analysis or assessment and plans for strengthening systems components needed for effective CHW and CBO service delivery, including leadership and governance, workforce, sustainable financing, digital tools and systems, supply chain, referral systems, and community-led monitoring, as well as the capacity of the Ministry of Health and CLO or CBOs in service delivery. Next slide, please. The 8 countries eligible are listed in this table, and the amounts proposed and have gone out in the allocation letters are in the middle, and the proportion that each amount is out of the total matching funds is included on the right-hand side. And I think that is it. I will hand over to my colleague Ralph now for scaling up programs to remove human rights and gender-related barriers.
Thank you very much, Nick, and hi everyone. My name is Ralph Jurgens, I coordinate the Global Fund's work on human rights, and I will be presenting on the human rights matching funds. Next slide, please. These human rights matching funds have been in existence in the current allocation, they've proven very successful in not only increasing investment in programs to reduce human rights related barriers, but also in increasing country ownership and commitment to reducing stigma and discrimination, gender-based and other forms of violence, and harmful laws and policies. So the main objective in this allocation remains to support and strengthen investment and commitment and country ownership to evidence-based comprehensive programming to reduce human rights-related barriers to HIV, TB, and malaria services. We want to, in particular, to advance programming to eliminate stigma and discrimination, and to eliminate harmful laws and policies, to integrate human rights programs into key population prevention programs, and to ensure that all human rights programming is at least gender responsive. And as I said, increasing and strengthening country ownership of human rights programming through development or revision of national costed strategies to reduce human rights related barriers also remains a key objective. Next slide, please. There's 24 countries that will be able to access human rights matching funds. 20 of them have received human rights matching funds before, and there's 4 new high impact countries that have been included in the so-called Breaking Down Barriers initiative. And those are Bangladesh, Burkina Faso, Nigeria, and Thailand, and they were included based on an analysis of needs and opportunities. Originally, we were hoping to be able to include all high impact countries in the Breaking Down Barriers initiative, but as a result of decreased funding for catalytic investments overall, the human rights matching funds investment was also decreased, and therefore we needed to focus on a smaller cohort. So investment in existing Breaking Down Barriers countries, the 20 countries that have received human rights matching funds before, will continue, albeit at a vastly reduced level, with the one exception, Ukraine, that will continue to receive exactly the same amount of human rights matching funds. And we're hoping to continue the progress that those countries have been making towards comprehensively removing human rights related barriers. We're currently undertaking progress assessments in all 20 countries that have received human rights matching funds in the past to identify what has worked, what the impact has been of scaling up investment, and commitment in human rights programming, and to make recommendations about what should be the focus and the priorities in this new grant cycle. The next slide, please. So access conditions, the financial access conditions in the 4 countries that will be able to access human rights matching funds for the first time is that they at least match 1-to-1 from within the allocation, the amount of human rights matching funds. For countries that have received human rights matching funds before, they need to maintain or increase the level of investment from the 2020 to 2022 allocation in programs to reduce human rights related barriers for this new allocation. And then the next slide, you will see the programmatic conditions. There are quite a few. I will only summarize them very briefly. They're based on our experiences made over the last 6 years. So for newly eligible countries, we expect these countries to undertake an assessment of not only the human rights related barriers that exist, but also of programs that already exist to address those barriers, and to base the funding request on the results of that assessment, so that we move, as we have in the 20 countries that have received human rights matching funds before, so that we move from ad hoc programming to reduce human rights related programming to evidence-based programming informed by an assessment. We also expect the countries to develop or update a national plan to reduce human rights related barriers, and to include in that plan a monitoring, evaluation, and learning framework, and to establish a mechanism that coordinates implementation and oversight of the strategy or plan. The 20 countries that have received human rights matching funds have all developed such a plan and oversight mechanism, and that has been very important. So we expect those countries to update, if necessary, their existing plans. Many of them expire within the next 2 years. So we expect them to update them based on the current situation and the progress that they have already made. We expect these countries that have received human rights matching funds in the past, in addition to that, to also determine baseline scores for each of the human rights programs areas during the country dialogue. This will enable us to report under the new KPI E1. We expect the funding request to take into account the results of the program assessment that I just mentioned a minute ago. And we want in those countries to see full implementation, ideally, of all human rights program essentials, and have a particular emphasis on stigma and discrimination, to take advantage of our partnerships with UNAIDS and PEPFAR and others as part of the global partnership, to eliminate all forms of stigma and discrimination, and of other partnerships with PEPFAR. The next slide. On this slide, you will see the 24 countries. Please move to the next slide. Thank you. These are the 24 countries, and for each, we have included the matching fund amount. You will see that the minimum is $500,000, representing quite a significant decrease from human rights matching funds available in the past to these countries. But in countries that newly access human rights matching funds, the minimum is 1 million. That's it. I look forward to any questions that you may have. Thank you very much.
Thank you very much, Ralph. We are now going to open for the Q&A session. So please do not hesitate to type any question you have in the chat. I see we already have a number of them. So I'm gonna address the second one before handing over to the presenters. So regarding, Anthony Yuan's questions on the presentation slide going out to registered attendees. So they haven't been shared yet, but we will share the slides by email to all registered participants. And you will also receive a link to the recording that will be on iLearn, uploaded on iLearn. So over to you, Emily, for the next questions.
Thank you so much. Before diving in, a few themes we saw across the questions and did go through that opening section a bit quickly, but let's take a step back here in terms of matching funds and strategic initiatives specifically. So in terms of the way that this process works is that when we are working with our board and our committees and our partners, as many of the presenters noted, we work on these three modalities that I mentioned that are in complementarity to the allocation. So these have been designated already. It's the first issue. So these are in the allocation letters that were received in December. And it is the CCM's responsibility to work on those and the implementation arrangements of these matching funds. In particular, the allocations are also within the allocation letter. There are also the strategic initiatives are included this cycle, and that is new this cycle. So I did want to take a step back on that before diving into the questions. I'm going to now hand it to Lily on the next questions.
Great. So I'll move on to number 5. I think that Emily just addressed this one in general, but just to note that all countries would have been notified of which matching funds they're eligible for and the amounts in the allocation letter. And as Emily noted, it's the CCM that would drive the application via the funding process. So for any questions regarding eligibility, the CCM would be a great point of contact. Shall we move on to the next slide? And so for question number 6, I think following on the same thread, the funding request would outline how the matching fund investments would be programmed. And these could be programmed via different principal recipients or subrecipients. So there's no requirement that it's only via national governments or CSOs. This would be determined in the funding request process. I think the question number 7 might be specific to the TB matching fund. Jamie, perhaps you could you speak to this one?
Is it a comment? I'm reading it as a comment more than a question, but yeah, but the question which I'm understanding from this is whether there's a need for technical assistance for countries that will be receiving money for matching fund. So just to clarify on that, I think in the typically technical assistance are provided through strategic initiative, and in the current TB matching fund, we did have on top of matching fund for TB, we had a strategic initiative through which TA is available. In the next round, in grant cycle 7, I should clarify that for TB, we're only going to have matching funds on the on finding and treating the missing people with TB, but there will be no support of technical assistance to the SI because there is no strategic initiative for TB in the next cycle. Having said that, I think as you all know, many of you may know, USAID particularly, and also the French initiative some of our biggest donors of Global Fund, they do have set aside funds which are being used to provide technical assistance to countries that receive Global Fund money. So we're working very closely with our partners to look at where TA needs are and how we can come together as a Global Fund partnership to close that gap as well in implementing priority areas of our matching fund. Over.
Great, thank you, Jamie. And I'll just read question number 8 for translation purposes. So can you provide us with the link to apply? To whom will this fund be addressed in government or civil society? We would like to know more clearly, please. Thank you. So again, the country eligibility for the matching funds was communicated in the allocation letter. So the funding amounts have already been designated by country. And again, I believe Lindsay put in the chat the details about how you could follow up with the relevant CCM for additional questions on this point. Lindsay, did you want to add anything here?
Yeah, I had just indicated in the chat the response to one individual that was not communicated to everyone. So just so that all of the participants in the webinar are able to hear the same response. To summarize what I think Emily and Lily have mentioned already, the Global Fund communicates both the allocation amount and the relevant matching funds designated award amount in the allocation letter that has been sent to a country coordinating mechanism. This country coordinating mechanism we call the CCM, and the CCM is responsible for identifying the implementers for these the grants that come from these funds. But these funds work together. These are not standalone grants. These are integrated funding approaches because we want both the matching fund amount and the allocation amount to work together to really drive the impact that these funds have been designated for. Now, what has been put in the chat by Jonathan is the link that anyone can go to get the information on how to contact a country coordinating mechanism representative, a CCM secretariat representative. So if you are an organization that is interested in being involved in implementation, to be considered as potentially a principal recipient or a sub-recipient or a sub-sub-recipient with a particular focus area or regional focus area, then you need to contact the CCM to propose your candidacy to be considered for an implementing role. That's not the decision that the Global Fund makes usually, unless it's a special country. But in the majority of countries, it is the CCM that identifies and selects the implementing partners.
Great, thank you, Lindsay. Shall we continue to the next set of questions? So this is a relatively long question. I'll maybe start reading and then we can pause more appropriate. So at first glance, there's a fair amount of overlap between some of the CI areas, and some potential activities might fit into multiple key intervention areas. For example, funding for CHWs is available through the Innovation Fund, CSNR, and Community Engagement SI. Likewise, there's funding from labs through the Innovation Fund and then through the lab system strengthening funds. Some countries are eligible for funding from some funds and not others within the same thematic area. How is it decided which countries are eligible and ineligible for within the same thematic area? So I'll pause there so we can talk about this point. I think that the question, as noted, is relevant to two matching funds, so the Innovation Fund and CSNR. And perhaps I can ask Olga to first speak to the approach taken for the investments relative to community health workers.
Okay, thanks for the question, Anthony. I agree that it's not extremely simple, and it's partly a reflection of some of the discussions that happened at the strategy committee and the board. So that's not why it's not quite as clean as perhaps we would have liked it. But basically what we're doing with the RSSH Innovation Fund is scaling up the number of countries that can get funding for community health workers as well as labs. complementing the money that's in the lab and the CSNR matching funds. So we were trying, we had a long list, for example, for CSNR, because there's a lot of countries that need help with community health workers. And some of those were allocated to the CSNR, and some of them were allocated to the RSSH Innovation Fund. But when it comes down to the implementation and sort of looking at them, we'll look at them as a group. So the CSNR team at the Global Fund will manage all of the CSNR, no matter where the matching funding comes from. And the same with labs. And I think Patrick wanted to say something about that as well. Over.
Yeah, thanks so much, Olga. So to be clear, the funding is managed through the same mechanism. The activity eligibility and the inclusion criteria remains the same. And so those 9 countries were selected in the same manner. In terms of overlap in activities, yes, there are potentially areas of overlap, as Rob had mentioned, through the Impact Accelerator, the Innovation Fund, and through lab system strengthening. And this is largely in digital systems. In lab system strengthening, we look at lab information systems, LMIS, and the LIMS systems as eligible for funding, versus the Innovation Fund looks at the broader digital ecosystem within the country. There is the potential that a country may have invest through one versus the other, or may request support that overlaps. The intention there that by investing in lab information systems through the lab matching fund, there's complementarity through the Innovation Fund, and that we advance the overall digital ecosystem. Having said that, we are not prescriptive in our approach, and so we are not defining for the country what they should be implementing. Through the funding request process, the country identifies and articulates their needs, and we simply support the country in defining how those needs integrate through the activities that we're funding. Back over to you, Lily.
Thanks, Olga and Patrick. So I'll finish the question, though I think it's largely been answered. So more directly, why aren't similarly focused funds combined? The Health Workforce Quality of Care area under the Innovation Fund funds activities similar to the CSNR fund, but in different countries, as noted on the slide. Why not combine them and have all the countries funded under a unified CHW-focused fund? And relatedly, how should applicant countries interpret their eligibility for one fund and not another in guiding how they develop their funding requests and in deciding what activities they include? So as just mentioned, the focus was really on ensuring that countries that need support in these areas that are eligible and meet the relevant criteria have access to the funds in order to maximize impact. And so there was less focus on which matching fund necessarily would provide the funding, and more focus on ensuring that holistically these investments were available. And so relatedly, countries really should focus on the funding that's available as communicated in their allocation letter. And they should use the funding request process to outline the activities that would drive the greatest impact. So perhaps we can continue to the next slide. So question 10 is, how will it affect the new allocation requirements to those countries who have not met the co-financing requirements in the current allocation period? Lindsay, I'm wondering if I can ask for your help on this one. I know that you already responded to a question in the chat regarding the STC requirements.
Sure. Noting that I am familiar, but I am not a health finance department representative. But I would simply indicate that the co-financing requirements have not changed for the coming allocation period. So the allocation policy and the requirements remain the same. Each country is indicated to each country what their co-financing target is in their allocation letter. It's also indicated what the co-financing target was for the current allocation period. Now, we do have occasionally situations where a country struggles to meet the co-financing target that was set for them at the beginning of the current grant cycle. In those cases, the country should be very closely working with the fund portfolio manager to identify by when they will be able to get back on track. In the cases where a country has not met the co-financing requirements in the current allocation period, this would be handled on a case-by-case basis. The Grant Approvals Committee is the body that has the oversight over the implications of not meeting co-financing targets and commitments. A country is asked to complete a co-financing commitment letter for the coming period, which will identify the amounts, the areas of investment, how it will be tracked, and when it will be reported on. So we are becoming increasingly more concrete around how and when we will measure the delivery of the co-financing requirement targets. But this will be something that each country's FPM, Fund Portfolio Manager, will be discussing directly with the CCM and then with the appropriate ministry on an individual basis in the months ahead. So the access to matching funds is not linked directly to the co-financing requirements, but the overall allocation and matching funds total funding amount could be impacted. In some cases, the amount available to a country is reduced if a country has not met co-financing requirements in the past. So that could be a consequence, but it's not a direct link only to matching funds. It has to do with the overall approach that the Global Fund has with co-financing requirements. I hope that was helpful.
I think it was. Thank you, Lindsay. So questions 11 and 14 are very similar, so maybe I'll just read them back to back. So 11 is, hello all, would it be possible to receive the allocation rationale of all the African countries that will help focusing on the support provided to them? Thanks. And question 14 is, hi there, I am on iLearn, but the recording for allocations overall outcome is not yet available. Any time frame for this? Thanks. So I believe that the information relevant to the allocation will be shared on the Global Fund website next week. And as part of the public website, we do share the information that's available about the general methodology. So that should be available next week. Perhaps when we send out the slides, we can send out a bit more information about the timelines there. I think we can move on to the next slide. So the last question I see, number 15, is do the CCMs have to decide and propose the use for all their 2023-2025 matching funds programming by the time they submit their budgets, which I understand to be in just a few months, even if they just got the info on the matching fund qualifications and amounts in December? So apologies, Lindsay, for all the requests, but would you be able to clarify on the relevant timelines?
Yeah. So each country, each CCM identifies in which window they will submit their funding request. The Global Fund does not mandate in which window a funding request needs to be submitted. But the CCM needs to be thinking backwards to consider how long it will take to prepare the funding request, go through the review process, go through grant making, and then have the grants signed and approved by the board to ensure that there is no gap in terms of programming between the current grant and the next one. So it is likely that many countries that have a grant that is ending in December 2023, it is very likely that they would come to window one. And the submission for window one is indeed at the end of March. However, they could also maybe think ahead about doing some of their grant making work in advance and consider coming to window two, which would give them a bit more time. That being said, in whichever window their funding request comes, they would need to present their funding request for both the allocation funding as well as the matching funding in a combined funding request. So the expectation of the applicant is that they are able to describe how they would meet the conditions for the matching fund and how it would be programmed already in the funding request, which then represents the total allocation and matching funds amounts. So all countries are in the same boat in the sense that they all received their allocation letters at the end of December. We were all scrambling madly to make sure that we got these out before the end of the year. Thankfully, they were all sent out. They were all received by the end of December. And we are aware that the countries that are preparing their funding requests for window 1 are doing so in a very short time frame. But obviously the Global Fund is doing its best to support those countries, both through country team support virtually, as well as some in-country missions, and of course, all the technical assistance that is available through strategic initiatives or through technical partners.
Thank you so much, Lindsay. And then I see a last question here, which I'll admit is not within the scope of what I'm familiar with, but I'm going to read it out. What does Global Fund accept as part of in-kind contributions where a CSO has committed to provide a kind contribution or co-financing? Is staff LOE acceptable or has to be monetary? So forgive the response, but I think this would relate back to the sustainability transition and co-financing policy that we mentioned earlier. And I believe we can provide a link there as well. And there is a last question from Anthony. So is it the CCM's decision to integrate application components, e.g. malaria, HIV, in their funding requests, or is that decided by Global Fund?
So I can answer that one, Lily. So it is indeed the decision of the CCM to decide based on the total amount of allocation that has been communicated to them. There is an indicative designated amount for eligible disease components. Could be HIV, TB, malaria, or 1 or 2, depending on the eligibility of the country. And it is encouraged from the Global Fund standpoint and from the technical partner standpoint, it is encouraged that CCMs think about integration as much as possible, as early as possible. And so ideally, a CCM would think about either a joint or an integrated funding request and think about how all the funds together would be most effectively used, considering the needs for resilient and sustainable systems for health as well. But it is not the Global Fund that makes that decision, except in the cases of high co-infection of TB and HIV. It is a strategy committee decision that the countries with the highest co-infection are required to submit a joint application for TB and HIV. But besides that, the Global Fund allows the ownership of the CCM to decide whether or not there will be separate funding requests, joint funding requests, or integrated funding requests, both at the time of the funding request submission and in terms of the grants themselves. The number of grants is not decided by the Global Fund. The number of grants is decided by the CCM.
I see we have more questions coming, so they will be pasted in the chat in a second.
So the last question, and Lindsay, maybe don't go anywhere. Is it possible for the CCM to modify the window of submission after indicating firstly the one they have chosen?
Yes. So as the allocation letters have now been sent out, we are going to be asking our Global Fund country teams to be liaising with the CCMs to then have a CCM register for a submission window for each of the funding requests that they have planned. So we will then keep a record of this registration and publish that information on the Global Fund website so that all of the external stakeholders that are supporting the funding request development are able to have some visibility on when the funding request completion and submission is planned for. That being said, it is very flexible. And if a country is aiming for window 1, they should register for window 1. And if there is some crazy emergency and in the end they just can't make it and they need to defer to window 2, that's okay. We can manage that. That's not a problem at all. We would just ask then that the CCM would inform the country team, who would then re-register them for a different submission window. So that does happen, and it's not a difficulty, it's not a problem. Our recommendation, as I said, is that you would register for the submission window that you are aiming for.
Thank you so much, Lindsay. It looks like those are all the questions for now. So maybe I'll just mention quickly that we're also planning to share matching fund guidance on the website and targeting the end of January for that. So that's something that applicants can also look out for. And perhaps I can turn it back over to Odd.
I think there are no more questions for the moment. Maybe we can wait just a minute to see if any question comes up. And then I will hand over to presenter to if there are any last remarks they want to mention. What question is coming? So maybe I can start reading it while my team is collecting it. Can these RSSH matching funds be included in the new C19RM allocations, or they have to be included in the GC7 funding request specifically?
Yes, so the matching funds should be included in the funding request specifically. The idea is that the matching funds are additive and catalytic to that allocation. And so they should really be addressed holistically along with the allocation funding in the funding request.
So there are no more questions in the chat. So I don't know if any presenter will want to raise any closing remarks or closing word before we end the webinar.
Odd, can I just mention something? I just added a link in the chat sent to everyone that is theglobalfund.org, and then I used English, applying for funding, sources of funding, catalytic matching funds. So that link that I've just put into the chat is where the guidance for matching funds, conditions, etc., will be published on the Global Fund website. And we will also have an overview of the amounts by country, by priority area that have been awarded and communicated in the allocation letter. So that is the link where the catalytic matching funds will be available. Similarly, there are catalytic multi-country funds, strategic initiatives, they have different links. But from this site, from that microsite, that page, you will be able to get to the other information about catalytic funding.
Thank you, Lindsay. So it seems that there is another question that just came up. Is there a separate template for matching funds, just as is the case for above allocation?
So the answer to that is there is not a separate template. There is a question in the funding request form where the applicant is requested to respond to how they have addressed the conditions and how the matching funds will be programmed and be catalytic to the allocation of funding. But the actual amount does not go into a separate template like the prioritized above allocation request template. It is integrated along with the allocation funding in the performance framework and detailed budget of the actual funding request itself.
Thank you very much, Lindsay. So I don't know, Emily, if you want to have a closing word, or if we should, or the other presenters, or should we close the webinar now?
Thank you so much. Nothing to add from my side, and I just want to appreciate the time for everyone and for those who called in as well, and for your participation and partnership. Thank you.
Thank you very much. So thank you very much to all presenters, and thank you very much to all participants for joining this session today. As mentioned earlier, we will share the presentations and link to the recording by email to all registered participants in the coming days. So thank you very much again, and goodbye.